Hi, good evening everybody. Tonight's session is about ice versus heat therapy for sports injuries. I get asked quite often what is the best thing to use when you injure yourself. So I thought I'll make a video and then I can just point everybody to it. So what I'm going to look at is how you can apply various modalities during the different stages of healing, because what you use really depends on where your injury is in the healing process. Now, apologies if you were expecting this to be a live stream tonight, but my internet has just crashed on me. So I'm recording this and I will upload it as soon as it goes live. But it means if you've got any questions as we go along, just pop them in the comments of the video and I'll come back to them, or feel free to message me or email me as you want. Oh yes, my name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy treatment for injuries. Good, let's dive right in. So what I'll look at tonight is different stages of healing, and we're going to first start with immediately after you injure yourself. So you're running along, you pull your calf muscle. What do? Do you put heat on? Do you put ice on? Most people know by now that you put ice on the injury, but do you understand why you've got to use ice at this point? The goal with putting ice or cold on a fresh injury is to stop the internal bleeding, because if you get a lot of internal bleeding, it builds up pressure and that can actually cut off the blood supply to the cells adjacent to the injured cells. So in the end, if that blood supply is cut off for long enough, you can injure more cells than what you should have injured in the first injury. So you can really limit the extent of the injury if you can stop that bleeding quite quickly. But now, very importantly, if you use ice for too long on one site, you will actually get a vasodilation, or the blood vessels will open up again and you will get more bleeding. So it's very important not to leave cold ice, or whatever you use, ice pack, any cold thing on there for too long. So what should you do? The safest thing to do is just put ice on for about 10 minutes at a time. So you place it on for 10 minutes, you remove the cold, whatever cold modality you're using, for 10 minutes so that the skin can heat up again, and then you replace it for another 10 minutes. So the idea of removing it for that 10 minutes is that the skin can warm up a bit. Otherwise, the brain perceives it as the skin is getting so cold that it is going to get frostbite. So then what it does is it sends blood to the area to protect the skin, and you get the opposite effect. So then you're going to get more bleeding. So important to put it on for 10 minutes, take it off for 10 minutes, put it back on for 10 minutes. Now, also during this period of time, you can combine it with very gentle compression. So remember, when you apply compression to a fresh injury, it's not as hard as you can, because again, you can cut the blood circulation off and cause your injury to be worse. It's just like a firm, warm hug that you want to give the injured area. And then remember that you always need to place something between your skin and the ice, because otherwise you can give yourself a burn. Now, a wet towel works really well, because the coldness of the wet, the water in the towel will help to transfer the cold to the skin as well. If you've got any condition that means that you can't feel things properly, so you've got decreased sensation, be careful, because you can actually cause yourself ice burns. So you have to check every few minutes whether your skin is still okay. If you have a circulatory problem, that your blood circulation isn't very good to your limbs or to your skin, you must check with your doctor before you use any types of cold or heat therapy, that they can just explain to you how to do it safely. Good, so that's immediately after an injury. Remember, your main goal is to stop the excessive bleeding, which will also stop excessive swelling, and that will stop your injury from being worse than what it should be. And what I also forgot to say was that you can reapply that ice, the 10 minutes on, 10 minutes off, 10 minutes on, several times during the day. So you can do it every 2 hours or so to get best effect during the first day. Now, the second part of healing, or essentially the first stage of healing, but the second step of the healing process, is that the first 3 to 5 days. That's called the inflammatory phase. Now, when people hear about the inflammatory phase, they think inflammation, we've got to get the inflammation down, let's take anti-inflammatories. Please don't do that. Inflammation is a really important part of the healing process. So within the first 3 to 5 days, what the body has to do is get rid of all the damaged cells, all the debris from the injury. And it does that through inflammation. So the inflammatory cells comes and they absorb the broken cells and gets rid of it. Now, if you have excessive inflammation, you can cause more damage than what there was originally. So we also don't want excessive inflammation, but just regular inflammation is totally fine. So there's some research out there to show if you use anti-inflammatory medication during those first 3 to 5 days that you can interfere with the healing process of muscles. But there's also research that shows it doesn't really make a difference. But my advice would be if you can get away without using it, then rather stay away from it. Ice is a good alternative because that can decrease the excessive inflammation, but not to the same lasting extent as any anti-inflammatory tablets that you take. So it won't interfere that much with your healing process. So the application of ice during this time is exactly the same as you would do on your first day. That you put it on for 10 minutes, you take it off for 10 minutes, and you place it back on for 10 minutes. And that 10 minutes that you give it a break is to protect your skin so you can get the skin to warm up again and that we don't get the blood vessels opening and creating more blood to the area. So yes, it decreases excessive inflammation, but during those first 3 to 5 days, depending on how bad your injury is, your blood vessels may still be damaged and can easily bleed. So it also still has a role to play with stopping the bleeding from being too bad, and it can decrease your excessive swelling during that phase. Let me just see if I'm forgetting to say anything there. Yeah, but otherwise it's exactly the same as after your initial injury. So no heat during this period so far, because heat makes inflammation worse. Heat also brings more blood to the area, so it can make swelling and bleeding worse. So stay away from heat within the first 5 days. That goes for contrast therapy as well. I often get people to say over the internet that if they've started contrast therapy, they've injured themselves today, and I just go, oh, stop doing that, because actually that will make it bleed more and can cause your injury to be worse as well. So leave contrast therapy and heat for after day 5, which takes me to the next stage, which is after day 5. Now, after the inflammatory phase is done and your body's got rid of all the broken cells, it now starts to create new cells. And it also strengthens these cells. And to do that, it needs good blood circulation and all the nutrients and exercise and other things that's part of the training. So you can actually use ice as well as heat, as well as contrast therapy during this phase. But sometimes if you've had a severe injury, you still have to be careful with the heat and contrast therapy. So just make sure that you check with a medical professional before you use any of these. Which one of those you choose will depend on what your goal is with it. So the first thing that you would use ice or heat or something for during this phase is for pain management. And all of them can be useful for that. So it depends on your preference. There's no, you should use this or you should use that. It all depends on what works best for you. Funny thing is that I find where ice often works really well to calm joints like ankles and things, the pain in that down, people find that heat is more soothing on backs and necks. So it really depends on the area of the body as well. But pain is a very subjective thing as well. So it depends on what makes you feel comfortable. If you are going to apply ice for pain, then there's really no limit to how long you can apply it for, because at this point, we're not that worried about getting more blood rushing to the area because we allowed more blood circulation in there. What I will say is just take care of your skin, because if you cool the skin too dramatically, you can get ice burns. So protect the skin by placing something between your skin and the ice, and check every 2 minutes that everything is still fine. Okay. If you're going to use heat or contrast therapy, same goes for the heat element. You've got to protect the skin, and you have to check constantly that you're not overheating it. Okay. Do not apply heat over areas where you don't have sensation, because you can easily burn yourself. And yeah, that's the main thing for the precaution with the heat. I sometimes forget the most obvious things when I do these. Oh yes, again, if you've got poor circulation, check with your doctor if it's okay to use either of these. And if there's signs of inflammation, do not use heat or contrast therapy, because it can make the inflammation worse. Now, signs of inflammation is if something is red and swollen and quite sore or painful to touch, and often quite warmer than the other areas around it. Those are signs of inflammation, and you don't want to bring heat or contrast therapy close to that. Then, if we think of, sorry, I've just lost my line of thought there. Okay, so maybe I should explain what contrast therapy is as well, how you can apply that for pain. So contrast therapy just means that you're contrasting hot and cold. And what they usually do is they would heat something for about 2 minutes, and then you would put cold on for 1 minute, but you build it up. So ideally, you want to start with quite warm for 2 minutes around the body part that you're trying to do contrast therapy on, and then quite cold for a minute. But then you go a little bit warmer for 2 minutes and a bit colder for 1 minute. And again, as warm as you can handle and as cold as you can handle. And you can continue that for about half an hour if you want, but just build up to that. Also, make sure that if you're using heat or you're using contrast therapy or any of those things, that you're sitting down when you do it, because it can make your blood pressure drop and you don't want to be passing out, please. Okay, so for pain management, you can use any of those three. If you want to help swelling go down, then ice or contrast therapy would be your better option. And that can be quite useful if you find that injury swells up at the end of the day when you've been on your feet a lot. Or if you've done a bit of exercise and you've just made a bit angry, you get a bit of swelling there. Then applying an ice pack, 10 minutes on, 10 minutes off, 10 minutes back on, can be quite useful for that, as well as the contrast therapy. I tend to not tell people to use heat for swelling, and I don't think anybody really does. I don't know if you found that it helps, go for it. But I have to also say, there's actually very little, if any, research to back any of this up. Nobody's really researched any of this properly yet. There's some reference to maybe if you use ice packs for ankle sprains that they recover a little bit better, but it's really weak research. And it's not that it's shown that it doesn't work, it's just that nobody's really researched it yet. Okay, so my advice to you would be that ice and contrast therapy is probably better for swelling, but if you find benefit from heat, you can go for heat. And then, oh yes, the important bit about ice is to not use it before you exercise. So if you're going to cool a joint or a muscle quite severely before you go out training, you're actually putting yourself at risk of injury. And the reason for that is that you also cool the nerve endings. So now the brain's not quite getting the message of where that body part is. I've spoken about proprioception and position sense in the past. So that is when you close your eyes, you know where your fingers and your toes and your ankles and everything is. So when you're running along, your brain, you don't have to look at every part of your body. Your brain senses through all your little nerve endings where you are, and it calculates how to place your feet, how strongly to contract your muscles, etc., etc. Now, if you cool those nerves down quite severely, that message is not transferred that well up to the brain. So that can actually cause injuries then, because you're placing your legs and things in an uncoordinated fashion. So make sure that you don't cool anything before you go and do sport. Excellent. So let me just recap, because I feel I've done this a little bit all over the show. Immediately after an injury, you want to use cold only. And the idea is that it stops the bleeding so that you limit your injury, okay? And you always do it 10 minutes on, 10 minutes off, 10 minutes back on, and you can do it every 2 hours. Then within the first 3 to 5 days after an injury, still only a cold therapy, no contrast therapy, no heat. And the idea there is to stop any further bleeding that may still be occurring, reduce your swelling, and just keep the inflammatory phase within its natural bounds. And then the third phase, after day 5, you can start using heat and you can start using contrast therapy where it's playing with hot, cold, hot, cold, hot, cold. And the idea there is, one, you can use all three of them for pain relief, depending on what you find best. For reducing swelling at this point, I would probably use cold or contrast therapy. And then just be careful, do not cool your joints or your muscles or things before you go and play sport, because you may actually predispose yourself to injury. Excellent. Let me know if you've got any questions. If you need more help with an injury, you can always check out my website. The link will be in the description of this video. And yeah, hope you have a good evening. Take care.